Have you ever wondered what sexual dysfunction in a woman is? It's a term that encompasses a range of issues, from low sexual desire to difficulty achieving orgasm. It's a common issue that many women face, yet it's often shrouded in silence and misunderstanding. Sexual dysfunction in women is not a singular problem. Rather, it is a spectrum of challenges that can affect a woman's ability to enjoy or even engage in sexual activity. These challenges can be physical, emotional, or psychological, and often they are a combination of all three. They can stem from a multitude of factors, such as hormonal changes, medical conditions, medications, aging, or even stress and anxiety. These issues can have a profound impact on a woman's life. They can affect her relationships, her self-esteem, and her overall well-being. They can create feelings of inadequacy, frustration, and isolation. But it's important to remember that these experiences are not a reflection of a woman's worth or her ability to be a loving and desirable partner. In this video, we aim to shed light on these issues, to break down the stigma and silence that often surrounds them. We will discuss common sexual problems that women face, including low sexual desire, lack of foreplay and arousal, difficulty in penetration during intercourse, lack of sex drive after having a baby, and challenges with achieving orgasms and sexual satisfaction. We will also explore possible causes and solutions, and emphasize the importance of communication and understanding in overcoming these challenges. We hope to provide a safe and supportive space for women to learn about and discuss their sexual health, and to remind them that they are not alone in their struggles. It's important to remember that every woman's experience with sexual dysfunction is unique, and what works for one woman may not work for another. But by gaining a better understanding of these issues, we can start to break down the barriers that keep women from enjoying fulfilling sexual relationships. Now that we've set the stage, let's dive into the first common sex problem women face: low sex desire. Is it normal to not want to have sex? The answer might surprise you. As we delve into our second topic, we're talking about low sex desire, also known as hypoactive sexual desire disorder. This is a condition characterized by a lack or absence of sexual fantasies and desire for sexual activity. It's one of the most common sexual dysfunctions in women, but it's often misunderstood. Now you might be wondering, what causes this? Well, there's no one-size-fits-all answer. Low sex desire can be influenced by a myriad of factors. It might be physical, like hormonal changes, medical conditions, or side effects of medication. Or it could be psychological, such as stress, depression, or past trauma. It can even be influenced by relationship or lifestyle factors. But here's the thing. It's not about how often you're having sex or whether you're having sex at all. It's about how you feel. If you're content with your level of sexual desire, there's no problem. But if you're distressed or unsatisfied, that's when it might be worth seeking help. Let's tackle some common misconceptions about low sex desire. First off, it's not just a phase or something that happens with age. While it's true that sexual desire can change over time, persistent low sex desire is a genuine condition that can affect women of all ages. Secondly, it's not a reflection of how much you love your partner. Low sex desire is about the individual, not the relationship. It doesn't mean you're not attracted to your partner or that you don't care about them. It's about your personal sexual desire and nothing else. So how can low sex desire be managed? There's no universal solution, but there are many options to explore. It might involve counseling or therapy, changing medications, lifestyle adjustments, or even hormone treatments. The key is to have open discussions with your healthcare provider to find what works best for you. Understanding low sex desire is the first step towards addressing it. Our next topic is lack of foreplay and arousal. Why is foreplay important and how does it affect arousal? Let's dive into it. Foreplay is the warm-up act before the main event. It's the time to explore and appreciate each other's bodies and to build up anticipation and excitement. Not only does it set the mood, but it also plays a vital role in preparing the body for sex, especially for women. When there's a lack of foreplay, arousal might be difficult to achieve. It's akin to trying to drive a car without warming it up first. You can do it, but it won't be as smooth or as enjoyable as it could be. Improving foreplay can be as simple as communicating openly about your desires and needs. Try experimenting with different types of touch, or even introducing toys. Remember, the goal is to make each other feel good and comfortable. Foreplay and arousal aren't just the appetizers to sex, they're integral parts of the whole experience. Now, let's move on to another common problem: difficulty in penetration during intercourse. Why does penetration sometimes hurt, and what can be done about it? This is a question that many women grapple with, and the answer lies in understanding a condition known as dyspareunia. Dyspareunia is a term used by doctors to describe painful sexual intercourse. It's not just about the physical discomfort, but also the emotional distress that can come with it. This condition is more common than you might think, affecting many women at some point in their lives. Now, it's important to note that dyspareunia can be caused by various factors. Some are physical, such as hormonal changes, certain medical conditions, or even the after effects of surgery. Others are psychological, like stress, anxiety, or history of sexual trauma. It's also worth mentioning that sometimes the cause can be as simple as lack of arousal or insufficient lubrication. So, what can be done about it? The first step is to approach a healthcare professional. They can help identify the root cause and suggest appropriate treatment options. These could range from topical creams and therapies to counseling sessions, depending on the identified cause. However, there's another critical aspect of addressing this issue: communication. It's essential to have open and honest conversations with your partner about your experiences and feelings. Remember, it's not about blaming anyone, but about finding a solution together. Your partner's understanding and support can make a world of difference. Moreover, it's crucial not to rush things. Take your time to explore what feels good and what doesn't. Experiment with different positions, techniques, or even the use of personal lubricants. And always prioritize your comfort and pleasure. Lastly, remember that it's okay to seek help. There's no need to suffer in silence or feel embarrassed. You're not alone in this. And there are resources and professionals out there who can provide the help you need. Next, we will discuss a very specific issue that many women face after childbirth: lack of sex drive. Why does sex drive often decrease after having a baby, and how can it be managed? After childbirth, a woman's body undergoes significant changes, both physically and hormonally, which can lead to a decreased sex drive. Factors such as sleep deprivation, body image concerns, and the stress of caring for a newborn can also contribute to this decrease. Additionally, the hormonal changes can cause vaginal dryness, making intercourse uncomfortable or even painful. But fear not, this is usually a temporary phase. The key to managing this issue is patience and understanding. It's important for partners to communicate openly about their feelings and concerns. Small steps towards intimacy, such as cuddling or kissing, can help in rekindling the spark. Remember, there is no normal timeline for resuming sexual activity post-childbirth. It varies for every woman, and that's perfectly okay. Finally, we will discuss one of the most misunderstood topics when it comes to women's sexual health: female orgasms and sexual satisfaction. What is the truth about female orgasms, and why is sexual satisfaction important? Let's delve into the fascinating world of female orgasms. You may have heard many things about them, yet much of the general knowledge is shrouded in myth. For instance, a common misbelief is that all women can reach orgasm through penetration alone. In reality, around 70% of women need some form of clitoral stimulation to achieve orgasm. Another myth is that women should have an orgasm every time they have sex. This simply isn't true. Orgasms are not the be-all and end-all of sexual satisfaction. In fact, many women can feel sexually satisfied without reaching orgasm. Now, let's talk about the importance of sexual satisfaction. It's not just about achieving orgasm. It's about feeling emotionally connected, respected, and valued by your partner. It's about finding pleasure in the journey, not just the destination. So how can sexual satisfaction be achieved? It begins with open and honest communication about what you want and what you don't want. It's about discovering what feels good for you and sharing that with your partner. It's about exploring together and not being afraid to try new things. Remember, everyone is different. What works for one person may not work for another. Don't be disheartened if things don't go as planned. It's all part of the learning process. One more thing, sexual satisfaction is not a destination, but a journey. It's not a box to be ticked or a goal to be achieved, but an ongoing process of discovery and connection. It's about understanding your own body, your desires, and your boundaries, and sharing these with your partner. In conclusion, female orgasms are as unique and varied as women themselves. They're not a one-size-fits-all experience. And sexual satisfaction? It's about far more than just reaching orgasm. It's about connection, communication, and mutual respect. That brings us to the end of our discussion on common sex problems women face. Remember, understanding and communication are key to overcoming these issues.